Since the 1990s, Nigeria has recorded some progress at reducing maternal and child mortality. Despite this progress, Nigeria still has a high rate of women and children mortality regionally and globally. Women and girls with disabilities are amongst its many victims. In October 2014, Disability Rights Advocacy Center (DRAC) and Center for Social Justice, with support from the USAID Strengthening Advocacy and Civic Engagement (SACE) project, initiated projects that aim to provide an enabling environment for maternal and neonatal child health and sexual reproductive health rights for women and girls in Nigeria.
My experience was when I was pregnant. I went to the hospital to register, but there were no interpreters, and the nurses and doctors were not able to understand sign language. When it was time for delivery, there was no sign language interpreter.
Many women and girls with disabilities face exclusion and discrimination within the healthcare sector. Services are not accessible, and it's difficult to even manage cases because of the attitude of healthcare workers. I have had personal experiences, so have many other women and girls with disabilities. And this is what prompted us to identify this as an important issue that needs to be addressed. And it prompted us to apply for the USAID grant in 2014.
Given the presence of the National Health Act, we aligned with the problems highlighted by this act, and we felt there was a need to jointly develop a national policy on the sexual and reproductive health of girls and women with disability.
The Abuja Declaration requires Nigeria to dedicate not less than 15% of our annual budget for healthcare services. Again, the National Health Act requires Nigeria to ensure the dedication of not less than 1% of the Consolidated Revenue Fund for the funding of the Basic Healthcare Provision Fund. These monies are supposed to go entirely to reduce maternal and child mortality and morbidity, to take care of vulnerable groups and those that are disadvantaged. And this is one of the reasons why we applied for the SACE grant, to ensure that we help the government and advocate for the provision of these resources and the right to health of Nigerians.
While there are positive responses towards maternal, newborn and child health challenges in the country, the work is not yet done. When I went to the hospital to tell the nurses that I'm having a headache, they gave me malaria drugs and some other drugs that caused miscarriage for me. DRAC and CSJ would continue to monitor that proper public financial management for MNCH is put in place and work to ensure that the national policy on sexual and reproductive health for women and girls with disabilities is operationalized with implementable guidelines.
Being the Federal Ministry of Health, we led the drafting process. Then we invited the Federal Ministry of Women Affairs and the UNAIDS and the UNFPA, while DRAC provided the technical support. Then in 2016, this policy was validated by all of us and other stakeholders.
While we were pursuing the national policy on sexual and reproductive health for women and girls with disabilities, we also kept in mind the awesome work that organizations like CSJ and HEFON are doing to increase funding for maternal, newborn and child health, and other advocacies they've been carrying out in relation to the National Health Act, and how that would also have a positive effect on access to health for women and girls with disabilities. This is why we embrace the 1% CRA for Health campaign by CSJ, and all of us who worked on that campaign were overjoyed when in May 2018 the budget was passed and the 1% CRA for Health was actually set aside in accordance with the provisions of the National Health Act. Just the next month in June, we had double joy when the National Council on Health approved and adopted the national policy on the sexual and reproductive health for women and girls with disabilities.